I'm Vivsha Dev. I'm Director of Cardiology at Los Robles Hospital. And my main area of work is minimally invasive procedures for fixing cardiac defects. Now, a heart attack is a condition which is obviously very familiar to most people in the public. On the anatomical level, it's caused by blockage of a small artery called the coronary artery in the heart. The coronary arteries develop in its inner lining deposition of cholesterol with time. We call it atherosclerotic plaque, and that with time grows in size and encroaching on the inner space through which the blood flows, and we call that as coronary artery obstruction. And then suddenly you have a plaque that would have blocked 20, 30, 50, 60% of the area of the blood flow, and formation of the blood clot suddenly makes that 100% occlusion. So sudden cessation of blood flow through a coronary artery then causes the lack of blood flow to the muscle that's being supplied by that artery. So that area then starts getting damaged progressively with time. That's the point. Longer the artery stays blocked, greater the damage. So those arteries then need to be opened up to restart the blood flow so that the damage can be stopped. And we figured that starting from point 0 up to 12 hours, opening up the artery would reverse some degree of damage. Sooner we open the artery, less the residual damage. And hence the adage, time is muscle. Faster we work, greater the salvage of the heart muscle that we can achieve. Heart attack presents with very varied symptoms, and that's one of the reasons why it gets misinterpreted or missed so often. The classical symptoms of heart attack are a chest pain or ache or pressure right in the mid part of the chest, which starts and then becomes unrelenting. Also could radiate or spread to the neck, to the shoulders, to the back, to the jaw, to the upper part of the abdomen, the epigastric area just below the rib cage. So essentially any unusual discomfort in the upper half of the body could potentially be a heart attack. It could be accompanied by numerous other symptoms that actually help us connect it to the heart. And those symptoms are people could be short of breath, you could break out into a cold sweat, feel very weak, lightheaded. Some people would feel nauseous and could be vomiting. And those symptoms of nausea and vomiting happen more often when the heart attack involves the lower surface of the heart, which sits on the diaphragm, and is then the symptoms mimic an abdominal symptoms. One of the things that we found is that the heart attack symptoms tend to localize in an area which has a pre-existing problem, where the threshold of pain is reduced, like people who have bad teeth or bad shoulder or acid reflux problem. There the heart attack symptoms start mimicking those problems, and hence making the identification more difficult, because you would think it's basically recurrence of my shoulder or my acid reflux or the heartburn. So the point is, if symptoms start suddenly, if you have chest discomfort or unusual discomfort in the upper body associated with marked weakness and shortness of breath, there is a good possibility that you're having a heart attack. You do not have to be certain that you're having a heart attack before you seek help. We'll take care of that part. So if you think you're having a heart attack, do not delay, call 911 and get yourself to the hospital.